While the other type of the injury of the upper limb is the most common type, glenohumeral dislocation or shoulder dislocation, and it is also labeled as the shoulder subluxation. This is the normal anatomy, while the anterior dislocation is shown here and posterior dislocation. It occurs usually in the anterior-inferior direction because of the lack of the support by the tendons of the rotator cuff. I will show you in the next slide that there is a lack of the support at the anterior-inferior direction by the rotator cuff muscle. So that's why the glenohumeral dislocation is most common in the anterior-inferior area. It can damages the axillary nerve. So this is the most common means the dislocation of the upper limb is the shoulder dislocated. Here it has been shown. So this is the slide that I have mentioned in the previous slide, that the anterior inferior direction there is no muscular support inferiorly, and this diagram is actually shown like it is the lateral view. It is a lateral view as the rotator cuff muscle are present. Here is the supraspinatus, infraspinatus, subscapularis, teres minor, while there is no muscle which is present inferiorly. So that's why the glenohumeral dislocation occurs anterior inferiorly. So when the shoulder has been dislocated, it has been present. The typical presentation of the patient is like that, as the humeral head is prominent in the at the lateral chest area, or it is in the slight abduction. Elbow, it is at the flexed, and the forearm is internally rotated and supported by the other hand. Now, the lateral epicondylitis, it is also known as the tennis elbow. It occurs due to the chronic inflammation or irritation of the origin or tendon of the extensor muscle of the forearm from the lateral epicondyle of the humerus. As the lateral epicondyle of the humerus is the common extensor origin, and the medial epicondyle of the humerus is also called the common flexor region. So the injury or inflammation of the lateral epicondyle can cause the lateral epicondylitis. It occurs due to the repetitive extension at the elbow joint. Lateral epicondylitis, as the most of the tennis player use the their extensor area, extensor muscle has been used in the during the playing of the tennis. So that's why we label it, the lateral epicondylitis is labeled as the tennis elbow. Medial epicondylitis, also known as the golfer's elbow, it is a painful condition which is caused by the small tear or inflammation or irritation in the origin of the flexor muscles of the forearm from the medial epicondyle. It occurs due to the repetitive flexion at the elbow joint. As in golfer, the player, there is a repetitive flexion of the elbow joint, and mostly the flexor muscle has been used during the playing of the golf. So that's why the medial epicondylitis is also labeled as the golfer's elbow. So this is the another comparison of the, as the tennis elbow is also caused is also labeled as the which disease cause the pain on the outside of the elbow, which is typically the tennis elbow, and the another disease which cause the pain on the inside of the elbow, which is labeled as the golfer's elbow. Radial head subluxation, also called the nursemaid's elbow. It occurs in the toddlers when the child is lifted by the wrist. It is caused by the partial tear or loss of the annular ligament, and thus the radial head slips out of the position. As the radial head, it is typically lies at their position due to the the ring shape of the annular ligament, which will hold the radial head in opposition to the ulna, and when it is get tears, and whenever there is a tear of the annular ligament, it will lead to the radial head subluxation, as I have shown in this slide. Cubital tunnel, it is actually the space of the dorsal medial elbow which allows the passage of the ulnar nerve around the elbow. At the dorsal of the medial epicondyle, this tunnel, cubital tunnel, is actually present, and it transmits the ulnar nerve and posterior ulnar recurrent artery. This is the cubital tunnel area. As I've already told you, the dorsal area of the medial epicondyle of the humerus, the ulnar nerve is passed through this tunnel area, and there is a ligament which will hold the ulnar nerve at their side, and when the ligament is passed around the ulnar nerve, then it will be look like a shape of the tunnel, which will label as the cubital tunnel. And the cubital tunnel syndrome, compression on the ulnar nerve in the cubital tunnel behind the medial epicondyle, which is also called the funny bone, it can causes the numbness and tingling in the ring and little fingers, which is the area where the ulnar nerve actually supplies. So this is the cubital tunnel area where the ulnar nerve can get damaged or injured and lead to the impingement of the ulnar nerve, and which will lead to the numbness and tingling sensations. Another is the carpal tunnel syndrome. It occurs due to the compression of the medial nerve and occurs due to the reduced size of the carpal tunnel from which the medial nerve is actually passed. It results from the inflammation of the flexor retinaculum. As you have to remember the anatomy of the carpal tunnel, the superior surface of the carpal tunnel is formed by the flexor retinaculum, and at the dorsal surface there is the carpal bone that has been present. So whenever there is an inflammation, then there is a swelling, and whenever there is a swelling, the area will be get reduced, and the structure that has been passing through this tunnel will actually get compressed, like the median nerve is passing through the carpal tunnel, and it will get compressed due to the inflammation of the flexor retinaculum, or arthritic changes in the carpal bones, or inflammation or thickening of the synovial sheaths of the flexor tendons. It leads to the pain and paresthesias, means the tingling, burning and numbness in the hand in the area which is supplied by the median nerve, and may also cause the atrophy of the THENAR muscles in the cases of severe compression, which will lead to the ape's hand. So this is the typical presentation of the median nerve injury. Means the median nerve can get injured as a transverse carpal ligament. Means whenever it is an inflammation, it will lead to the injury of the median nerve. So this is the basic means the cutaneous distribution of the different nerves. Whenever these nerves get injured, it will lead to the these areas will get the tingling or burning or numbness sensation. Thank you.